Good morning, good afternoon, or good evening, depending on where you are. And thanks for joining this ExChange Wales webinar on creating and managing parental advocacy programs. We're really pleased to be joined by David, Carman, and Clive today, and I'll let them introduce themselves as they present. The plan for today is that they're going to present for about 45 minutes-ish. And then we will have a short period of time at the end for people to ask questions. If I can ask you, if you have questions, if you can put them into the chat, and I will chair those at the end of the presentation. So I'll hand over to the three of you. Thank you.
Great, thanks, Martin. Hopefully you can hear me okay. I'm going to start just by giving a brief overview of our research. My name's Clive Diaz. I've been running research studies into parent advocacy for the last 4 or 5 years. I used to work for Cascade, and now I work at Swansea University as an academic. I'm just going to try and share my slides. So I'm going to speak for the next 12 to 13 minutes about just a brief overview of why we think parent advocacy is important, a bit of background, the research we've done on parent advocacy, and then I'm going to pass on to Carman and then on to David. So we've been doing studies, like I said, using sort of realist informed approaches to look at how parent advocacy works in England, Wales and Ireland. We're trying to work out how parent advocacy can help, sort of how and whether it helps parents feel more involved in decision making where there's child protection concerns for their children. There's many reasons why this is important. The child protection system, we know from numerous studies, including our own, is intimidating and oppressive. Parents often feel unable to meaningfully participate in decision making. They feel, very done to, and research has suggested from the States and indeed in parts of Europe that parent advocacy can help to make it less of an oppressive experience, and also leads to parents feeling a bit more involved in decision making, which is, we feel is really important. Just want to give a bit of background. Going back 12 or 13 years ago, we did some research in a couple of authorities in England, interviewing parents about their experiences of child protection conferences and of social workers, and particularly the Child Protection Conference, which is a multi-agency meeting which we have in England and Wales to decide whether a child is at risk of significant harm, and if so, what action to take, whether there needs to be some sort of child protection plan in place or not. Parents found these meetings incredibly difficult. They're saying it quotes like, "It makes you feel like a school kid and inferior. I was worn out, it's traumatic." And, we spent this research time interviewing parents about this. We heard the same stories again and again, and we were increasingly feeling, well, what can be done about it? And then we heard of David's work in the States around parent advocacy, and we heard of some Tim and Carmen's work in London and also it's starting to happen in Wales. And we thought, well, this might be a positive way of actually improving the child welfare system and making it less oppressive and difficult for parents. This is a quote from David's sort of review of the key literature about what a definition of parent advocacy. He said, parent advocacy is a form of peer advocacy where parents who themselves have had experience of the child welfare system help other parents involved to navigate it. In addition, they may also help to develop strategies to change the system. So that's a definition. Now, in the UK, we've seen parent advocacy develop in slightly different ways, and there is also what it's called in the literature, we're not particularly keen on the term, something called professional advocacy. So these are parents often working for these agencies who don't tend to have had experience of the child welfare system themselves, but they then they work for charities, they may have been advocates for children, and they do support parents through the child protection process. Now, we feel this model has its strength. It's definitely better than nothing, but generally our view as a research team at least is that the peer model, when it's done properly and done well and peer advocates are supported, is more meaningful and more helpful because it is someone alongside the parent who's been there, who's been through this terribly difficult experience themselves. They're an ally, they're alongside them, and that's really powerful. And for the parent, it's not just another professional in the room. So we feel that that is really important. And the practice guidance that David led on is very much focused on peer parental advocacy. So I'm just going to give some headlines really from our research on parent advocacy across England and Wales and Ireland. We must have carried out interviews with over 150 parents and social workers and senior leaders and parent advocates. We've done observations of lots of child protection meetings, child welfare meetings, both with parent advocates there and without. We've done surveys, we've looked at the key literature, scoping reviews and narrative reviews, and then we've started to develop theories about how we feel parent advocacy works and in different contexts and how it's experienced by different people. And then we have workshops to sort of test and refine those theories to try and make it more in depth and more accurate. We've done research across England. We're doing a Nuffield funded study at the moment in 4 local authorities in England, 3 that are using the peer model, 1 that's more of the sort of professional model. And then in Wales, interestingly in Wales, it seems to be more of a professional model that's been prominent, and also in Ireland, which was a service provided by Bernardo's. And these are sort of the 3 key themes from all that data that we brought together that I'm just going to briefly outline. So pretty much all the participants that we've interviewed and carried out focus groups with agree that parent advocacy, having a parent advocate there, has a positive impact on the parents' experience of the system. They feel they've got someone alongside them. They feel that they are being listened to. They have an understanding of this incredibly complex process, which before felt, impossible to understand. And they feel like their views are taken seriously. And really interestingly, lots of parents across these, 3 large parts of England, Wales and Ireland have told us, pretty much all parents we interview, we don't ask them about this, they just tell us about it's remarkably different the way that social workers treat them and talk to them when their advocate is there compared to when the advocate isn't there. And that's kind of worrying as a social worker, like what's going on there. You'd hope that we'd treat people respectfully all the time, wouldn't you? But actually what we're hearing is that having an advocate in the room makes a big difference. There's also a sense that it seems to improve parents and social workers' relationships. It's less adversarial, there's less paranoia, less worry from both parties. It can become a very adversarial relationship. It reduces that from happening so much. And sort of rebalances this power relations. Now, having said that, there are, of course, challenges. There's challenges around long-term funding. There's challenges around training and supervision. It's so important, particularly for peer advocates who've been through the child protection system themselves, that it can be very triggering for them to be in a meeting and go through it and observe things that happen to them going back. So really important they have in-depth supervision and in-depth support. And of course, like any change, particularly one that is potentially quite radical, 2 sets of people, parents and social workers, working together in a way that doesn't normally happen, there is some system resistance, and some people are, skeptical. Having said that, most people we've spoken to are very positive about it. So in terms of just going to talk about the themes in a bit more depth before I pass on to Carmen. Impact on parents. My advocate has changed my relationship with social workers. This was a quote, because I learned how to express myself. So parents are more able to express themselves, express how they feel. I used to chair child protection conferences, and the number of times that very unfairly, in my view, the report would be provided to the parents on the day. Sometimes we would give parents the opportunity to cancel the meeting, but if the report was provided just a few hours before, but often parents say, no, I want to go ahead. Often there was information in the report they didn't agree with. There was other agency reports from the school and health that they were provided for during the meeting. And they often felt, very blamed and very shamed by this process. But having an advocate there helped parents to feel less that sense of blame and shame, and they're able to express themselves, which in turn has a very positive impact, because it means what would happen, what can still happen, but more often without a parent advocate, is the parent, understandably, in many reasons, gets annoyed or angry because of what's in the report or because of what's said in the meeting. They then get up and leave the meeting, shout, maybe swear at the social worker or the chair. And then that, which I think is a fairly natural response given the situation they're facing, is then used against them. But with the parent advocate there, that's much less likely to happen. The parent advocate can say, let's take a 5 or 10 minute break, let's think about this, we can gently challenge it, and it's much less likely to escalate, and then that information be used against the social worker. So it helps parents feel more supported. It's more, social workers are more likely to listen to the parents' perspectives because the way it's presented. And, you know, some great quotes. My advocate has been my rock, which makes me feel more comfortable and confident as I know she there's as I know she is there supporting and helping me along the way. So impact on social work practice. Having an advocate in meetings helps to change the dynamic. You know, parents are less defensive and more engaged. I mean, interestingly, I'd argue that social workers are less defensive and engaged, and more engaged as well. Better engagement, it bridges this communication. It seems to improve the parent-social worker relationship where it's less paranoid on both sides and more working together. We both ultimately, we want the same goal, right? The social worker, the parent, they want the family to be okay and the kids to be safe. So trying to act as a bridge, that's really, really important. Like I said, there are implementation challenges. I've touched upon this. There is real issues, particularly around sustainability and funding, and that's a problem. You know, it's very difficult to get long-term funding. Interestingly, in Wales, the Welsh government have really put quite a lot of money into it, and that's really good to see. We're hoping the DFE, you know, they are starting to fund in England parent advocacy services, but there's still a lot more work to do. And like I touched upon earlier, there's also issues around system resistance and role clarity. So overall, we would argue from all our interviews, all the data, all the research we've done, that parent advocacy helps to empower parents. It helps to improve communication, breaks down the fears of mistrust. It challenges sort of misunderstandings parents have about child protection services, you know, and there is a lot of fear out there. If we look at the statistics, you know, Martin's done research on this, you're 12 to 13 times more likely, maybe more, to have your children removed if you live in a poorest 10th centile than in the richest 10th centile. There's communities in the UK where, you know, a high number of children have social workers, and there's lots of rumors that go around and concerns. You know, I've done multiple focus groups with parents where they say social workers get a bonus if they remove our children. Having a parent, obviously that's not true. Having a parent advocate there helps reduce that fear and that and reduces the myths that go around, and parents feel more supported and more engaged. So I really do feel, obviously I might be a bit biased, but I do feel it really does change things in a very positive way. And gives parents the right understanding of the situation they deserve. So finally, you know, parents feel safe, they feel respected. The advocates model a relationship, actually not just for the parents, but for the social workers as well, I'd argue, about empathy, about non-judgment, relationship building. And it leans and moves towards, particularly if you've got system advocacy going along as well, a system that's flexible and focused on shared decision-making, not just professionals making decisions and sort of doing too. So finally, in conclusion, we know that the child protection system is complex and difficult. Social work caseloads are high, lots of difficult to navigate processes. There's still this power imbalance, which has an impact on parents and their ability to have a voice in decision making. But we do feel peer advocacy offers some real emotional and practical support and can make a real positive impact. And we feel that our findings and our research is really showing the value of parent advocacy in making child protection, the system, more accessible and more parent inclusive, and ultimately also better for children. So I'll stop there and I'll pass on to Carmen, if that's okay.
Hi, thank you, Clive. And hello, everyone. So I'm Carmen Out, and everyone call me Carmen. So you can call me Carmen. So, and I am part of the research team for the Clive's Parental Advocacy projects. And I'm coming to it with my own lived experience of the child protection process. So it was years ago, many, many years ago. So my child was removed from my care he later came back, but I didn't have an advocate myself, so I gone through it all by myself. And living through that changed how I see the whole system, not as a professional or practice, but as a parent who knows what it feels like to be on the other side of the table. So that experience led me to get involved in developing a parental advocacy service in my own local authority. And I also work directly as a parent advocate and support other parents going through the child protection process. And later, I began helping other local authority to build their own service and drawing on what we have learned from that first experience. So I'm also involved in social work research, and especially around advocacies and family group conferencing. So I move between research, practice, and lived experience, and each gives me a slightly different view of what real change looks like. When I think back to what I first started as parent advocate, and what stand out isn't policies or process, and it was that feeling, the feelings. So parents very often come to advocacy when they feel they have no power left, and they were scared and confused by professionals' language and not sure who's really listening. So exactly a lot of many different issues. And my role wasn't to be there to fixing problems for them, but to help them to find their voice again, and to remind them they still have one, they still have their voice, so and also their rights and to speak. And sometimes that means I don't need to voice for them. I could just sitting there quietly beside parents in a child protection conference, just being there while they find their words. Sometimes it means helping them to prepare to write down what they want to say, or practicing and how they explain something they were afraid of being judged for before. So I think the preparations, most of my work is focused on the preparation and the relationship I have with the parents, so they could have the confidence to speak in the conference themselves. And the moment that stay with me when parents realize they can speak for themselves again is really nice when I see that, and that shift from being talked about to being part of the conversations, when you see somebody is so fear or so angry, but when they are confident speaking in the conference, and the whole situation and the feelings change in that environment. So that's what good advocacy look like in real life, I think. It isn't loud or confrontational. It builds on trust and respect, and it takes time, and it needs honesty from both parents and professionals. So it's not just I think it's not just from one side. It's from all parties to have this trust and relationship where the advocates in between to brought it all together to have the success or positive outcome. When I work with local authority to build advocacy service, I see how tricky it can be from that side too. So most people seriously wanted to involve parents, but the system itself is built around control, compliance, and risk. Yeah, so when advocacy is kind of like us professionals to share power, and that they can feel uncomfortable sometimes, I think, because they were in that their comfort zone for so long. When these new things come in, I think people need time to adjust. And I think creating the right conditions for parent-led advocacy starts with attitude, not with funding. Well, obviously funding is very important, but you can pay for service and still miss the heart of what it is. If the culture isn't right, however much money you put in it just wouldn't work. I think the culture and the attitude and mentality of the professional and the local authority, that they need to get this ready before they go. And it works best when local authorities are open to learning with parents and not just about them. When they bring parents into planning meetings, listen without defensiveness, and see advocacy as part of the system and not a side project. I think at the same point, both sides were scared. The parents were scared, would go into seeing all these professionals. But then I think when professionals first, they see, oh, the advocates there, they might scare as well. So they might scare, oh, there is somebody here so watching us to witness what's happening in the meeting. So, but I think we should do it in, it's not about fear, we are actually breaking down the fears to be more relational. So in my own local authority, where I was first involved, we start by holding small reflective sessions where parents and social workers, we talk together, and from those early conversations, it came a shared recognition that parents need independent advocacy to take part fully in the child protection process. That will we've seen it will be benefit for both sides because the advocates have that lived experience. They understand both sides, that we could smooth things around and build bridges between both sides. So, and that insight straight how the service was developed and helped create that independent advocate role to support parents in my local authority. And because we did that groundwork and the service grow from a shared place of understanding, so I think we are doing well, and it's almost 5 years now. So we still have so many referrals coming in, and the chairs also really positive, social worker really positive, and there are many referrals. So that was a good sign. And of course, there are also other practical things that will help, the clear referral routes and proper training for the advocates and the space to reflect and learn. So, but this is the real shift is the power. Is about creating an environment where parents aren't treated as a problem to be managed, but as a people, as the person with insight and experience that professional also can learn from them. And that takes, I think, humility, because no one will know everything, have all the knowledge of everything. Every day you're learning, every case is a different. So I think it takes humility to learn in this process as well, everyone involved in the child protection process. So for local authorities, it means accepting that change won't always be tidy or easy, so they need to prepare. And also for advocates, it means balancing empathy with honesty and standing beside parents but also helping them work with the system in a positive way. That's advocates what to do. And when those pieces, everything's come together, the tone of the practice will change and the meeting will feel more calmer. You won't see parents shouting or yelling or being described as aggressive. I have this experience, one parent, and she's been really social worker said she was a bit difficult and always shouting. But did you ever wonder why she shouts? Because when people don't get hurt, they shout. They want to be louder. They want their voice be heard. That's why they shout. So, but after I work with her, then we actually understand when you need to work with people, you want your point comes across. You don't need to shout and then obviously there's a lot more other work I did with her, but then her attitude changed. And when she understand more, and also social worker understand her as well. So later on, that conference will really change. It's so different. So even the chair who told me that is really they see the change in the parents and how they work with in the CP conference. So when decisions are made with families, not made with family, but not for them. So that is really important. We need to remember that we are working with and not work for or doing to. So parents begin to trust again. And also I have social worker who said to me, oh, it was really nice that the environments change, and it also helps us it feels like less hostile because everyone's really working together, and also remind them why they come into the social work at first place to support people. They're not coming to judge people or further harm people by removing children or make difficult for families. So they are actually working together and have parents' input, and so that encouraged the participation. That was really important. So what does it take to build all these conditions? So I think it takes the courage to give up controls, and it takes consistencies and not short projects that disappear after a year, but we're looking for a steady long-term commitment. You could at first maybe you want to test, but how much you put in, you can't just be half full of glasses confidence. I think you gotta be all in to try. You have to all in to make sure this is steady. We are looking for long-term results, not just immediate change. Sometimes I think this, especially the relationship, we need time to build, and they also take leadership to that see the lived experience as a real part of the work, and it's not tokenistic, not just consultations, and it's empowering people that participate. And when you get that click, and then that will work, and that's what my belief. And it takes belief as well. So believe that family can change when they are treated with respect, and that's really important. So parent-led advocacy isn't quick fix, and it's a cultural change. But if it done well, and it can transform everything, and how decisions are made, and how meeting feels, and how people treat each other. And that's what that practice guide is here for, to support a shared language and some practical tools, and a reminder that advocacy isn't something we do for parents. Like I said, it is something we build with them together. So David is going to talk us through this practice guide. So I hope it will help to support this work. Yes, thank you.
Hi, thank you, Carmen. I'm David Tobis. I've been involved in parent advocacy, supporting it in child welfare for 35 years now. I'm delighted to be here to see so many different organizations represented from quite a few countries. And I'm also delighted that Clive described what parent advocacy is, and Carmen described the experience of a parent advocate. And Clive also mentioned some of the research that's been done. So I can focus on the practice guide on how to create and manage a parent advocacy program, which I wrote along with Clive, and we had support from the Cascade Research Advisory Group, which consists of parents, and from the Suffolk Local Authority, which has parent advocates and advisors who help shape this practice guide. The practice guide is not a cookbook of how you create a parent advocacy program, but it gives you things to think about, some ideas to consider. And so I'm going to give you a taste of what is in the practice guide. Before I do, can we have the first slide? Next slide, please. I want to mention what's going on around the world in parent advocacy and child welfare. There are at least 100 peer-to-peer support parent advocacy programs in child welfare in perhaps a dozen countries around the world, primarily in high-income countries. Most of these programs are still in the United States, New York, where parent advocacy really took off. There are at least 100 trained parent advocates working in foster care agencies, preventive service agencies, advocacy groups. There are parent advocates even working in law firms in interdisciplinary teams supporting parents going through the legal process. One of the states in the United States, Iowa, has the most parent advocates of any place in the United States. 48% of all parents with children in the child welfare system are assisted with a parent advocate. England has at least 9 local authorities with parent advocacy programs, and there are probably a dozen other local authorities where parent advocacy programs are being considered or developing. And the other countries in the UK, Northern Ireland, Scotland, and Wales have different models of parent advocacy, and Australia, Canada, Finland, Norway also have parent advocacy programs. And there are probably several other countries that I've missed. But it's a beginning, developing movement to have parents involved in decision-making and helping other parents in the child welfare system. Next slide, please. When you're considering creating a parent advocacy program, it's important to define what are the founding principles, the values of your organization. And these 7 principles were developed in discussions with parents, with parent advocates, with academics, with social workers. These may not resonate with you and your organization, but I think they're so important. I want to just read what each of these principles is. First, participation is central to human rights. 2, the United Nations Convention on the Rights of the Child recognizes child participation as a right, and parents are central to child rights. 3, we are not all the same, but we are all equal. 4, parents are the experts of their lives and their families' needs. Parents' opinions should be central to the child welfare decisions. The child welfare systems should focus on removing people's poverty, not their children. 6, parent participation should shift the balance of power from agencies towards families and communities. And 7, the ultimate goal of parent participation is to improve the well-being of children and families. You should find for yourself what are your founding principles. Next slide, please. In creating a program, you need to think about to what extent parents will have influence and power in the organization. A group called Rise Magazine, which is probably the preeminent parent advocacy program in the world, is based in New York City, and they define 3 different levels of parent participation. An organization or an agency or a program can be parent-led, parent-influenced, or parent-supporting. A parent-led organization, parents have the power and lead the organization. At least half the staff and half the governing board are parents. Parents have significant influence on programs, policies, and budget. The second level is a parent-influenced organization. Parents are actively involved in shaping the program. Parents are fewer than half the staff and half the governing board. And people with lived child welfare experience, people without lived child welfare experience are gatekeepers to power and decision-making. The third type is a parent supporting organization. These are organizations where allies hold institutional power. Parents act at the pleasure and around the priorities of allies. A parent supporting program can be tokenistic, and you need to think, where do you want your organization to fall on this spectrum of parent participation? Next slide, please. To begin to create a parent advocacy program, a lot needs to be done in preparation. You can't just plop a parent advocacy program into an existing agency. Parents should be involved in the planning from the very beginning. As soon as the idea develops that you want to create a parent advocacy program, you need to bring parents into the process. You need to create a collaborative process so that parents and social workers and administrators are working together in a collaborative way. You need to ensure that adequate resources are available, funding, staff, administration, knowledge, and skills. And you need to define roles clearly so that social workers know what their responsibilities are and parent advocates know what their responsibilities are, and that will reduce the level of conflict if roles are clearly defined. And from the very beginning, you need to begin to think about sustainability. Once you create a program, how is it going to last permanently? And you have to address resistance and concerns that staff and external partners have. And the resistance is inevitable. The next slide is going to talk about how to overcome resistance. Next slide, please. Organizations that have already set up parent advocacy programs have dealt with resistance and developed several approaches that reduce the resistance and increase support. To hold safe forums within the organization where you can talk about problems and conflicts and mistakes that people have made in an environment where people don't feel criticized and punished for what they've done. You have to create well-defined roles, as I described, and you can share research. Some of what Clive has described, there's a lot of other research, which I'll mention in a minute. You need to share this research to document the efficacy of parent advocates so that social workers and people who feel resistant can begin to change their attitude. Social workers who have begun their stance towards parent advocates in a very critical, doubting way, many of them have changed their minds and have become supporters of parent advocates. That can be presented to people who feel resistant. You need to work with management to establish a supportive culture so that people can feel safe. And you want to increase the chances of parents with lived experience who are working as parent advocates to be in contact with the social work community, not just as clients, but as experts of their lives and experts in helping others. There's sociological research that documents that contact reduces prejudice, and that is what I've found is the most persuasive way to get people to overcome their resistance to have contact with parent advocates themselves. Next slide, please. What parents want parent advocates to know? We spoke to many parents and they told us they want parent advocates to be trauma-informed, to recognize grief. Trauma is rampant throughout the child welfare system, and parent advocates need to know how to deal with that. They need to get to know the parents as people, as parents, and to empathize with them rather than to judge them. Parents wanted parent advocates to be available 24/7, at least by phone, if a crisis develops, so that the crisis does not spin out of control. And parents said they want parent advocates to have shared their experience, to have lived through the child welfare system so that they know what the parents are going through. Next slide, please. We asked parents what they want parent advocates to do. They told us that parent advocates should inform parents of their rights, their entitlements, their responsibilities. They want parent advocates to help them understand the formal procedures in their case. They want to mediate. They want parent advocates to mediate between a parent and a social worker. They want to be encouraging, supportive, and validate a parent's feelings. They want parent advocates to take notes during meetings so that they can help them process the information that they've been given, which oftentimes is overwhelming. They want guidance to help the parent fill out required paperwork, and they want to be linked to services and supports, and they want the parent advocate to help them secure the supports they need. One other thing that parents want parent advocates to do is that parent advocates should be part of the process to hire new staff, especially staff who have contact with children and families. Suffolk local authority has done this to a very significant extent. The Suffolk local authority has a lot of experience creating a parent advocate program. It's one of the most effective parent advocacy programs around. I'd encourage you to learn from what's happening in Suffolk. Next slide, please. Parent advocates need a lot of support to be able to do their job effectively. They need a supportive work environment where there's trust and collaboration. Parent advocates want to be trained. They want to be trained training that's conducted by parents and allies together using a curriculum that was developed jointly by parents and allies. Parent advocates want to be supervised. They'd like to be supervised by more experienced parent advocates or by social workers. Parent advocates want to have support groups where they can discuss their problems, their difficulties, their emotional trauma that they're experiencing while being parent advocates. Sometimes those parent advocate support groups can be with just parent advocates, and sometimes they can also have social workers present. And they emphasize that it's important for parent advocates to be reimbursed for their work, to be paid for what they do, for their expertise. It is extremely difficult to have a sustained, robust parent advocacy program unless parent advocates are paid for what they do. Next slide, please. Parent advocates need to be trained to be as effective as possible. They want training in what are the goals of what peer-to-peer support is supposed to do and accomplish. They want to know what the laws are, the policies, the regulations, and procedures of the child welfare system. They want skills in communicating both with parents and in public speaking. Self-care is important. It's a stressful job to be a parent advocate. They want to learn how and be supported in having self-care. They want to lead and participate in support groups. Parent advocates want to learn how to write about their lives and their recommendations. Rise Magazine has an excellent training program in writing parent stories. They want to learn how to advocate for themselves and for others. And they want to deal with trauma and secondary trauma. And they also want to know how you establish and maintain boundaries. Next slide, please. Agency staff also need training, but the primary training that agency staff need is to how to work collaboratively with parents, to partner with parents, so parent advocates, so that they can be in leadership positions. Next slide. When you're going to create a parent advocacy program, it's important to think about the strategy to get the support and resources you need. You need to identify people in strategic positions who can help you. It's useful to convene public forums with government officials, academic, policy people, administrators, anybody who might be supportive of your advocacy program or help give you resources or just want to learn about it and might consider creating a parent advocacy program. You want to identify allies in child welfare who can refer families who would benefit from a parent advocate. The best way to begin is to talk to each other. If you have the idea that you're interested in creating a parent advocate program, parents should begin talking with other parents. Parents should talk with allies, and allies need to talk to each other. Don't think about this alone. Bring other people in as soon as you have the idea that you're considering creating a parent advocacy program. Next slide, please. There are lots of other issues to consider, many of which are discussed in the practice guide. These are just a few of what I think are the most important ones for you to focus on. Power imbalances, as Carmen mentioned, are rampant throughout the child welfare system. There are power imbalances between social workers and parents, between social workers and parent advocates, and between social workers and the bureaucracy. Sometimes social workers feel as disempowered as parents feel, and those imbalances, those power imbalances, need to be identified, labeled, and addressed. Trust is key to successful outcome for any program. Trust is something that has to be developed and nurtured and continue to be developed throughout the program. You have to recognize that conflict is normal and that mistakes are inevitable in any program. When I ran the Child Welfare Fund, which began to promote parent advocacy, we had a phrase that is, if you're not having mistakes, you're not taking enough risks. Many things have to change to have a successful parent advocacy program. You can't just plop a program into an existing agency. You need to address and change the culture, the structure, and the function of the organization so that it's receptive to this new approach. Next slide, please. There are lots of resources that are available out there to help establish a parent advocacy program. PFAN in the UK has a website. It has webinars, trainings, parent support groups. It's a tremendous resource. Relational Activism, another program in the UK that teaches how to co-produce projects, to have participatory activities going on. It's an excellent resource in groups working together. The International Parent Advocacy Network has produced several documents that are useful. One is the International Review of Parent Advocacy and Child Welfare that I wrote with Andy Bilson and Nisuri Katugampala. It reviews parent advocacy throughout the world. What is parent advocacy? It brings together much of the research that had been done on parent advocacy, much more than Clive talked about. And it presents models of child welfare parent advocacy in different countries around the world. I think there were about 15 different models presented. The other document that's been produced by the International Parent Advocacy Network is the Toolkit for Transformation. This is a document written by and for parents from many different media sources that talks about how you administer and run and support a parent advocate program from the perspective of parents. Rise Magazine, as I mentioned, does training. They train throughout the United States and somewhat throughout the world in how to be an advocate and an activist, to not only provide peer-to-peer support, but how to work to change programs, policies, and systems. The final resource is from the United States government. It's the Child Welfare Capacity Building Collaborative. This has a lot of useful resources on parent advocacy and policies. While the Trump administration is running the government, they've screwed up so many things, destroyed the government in many ways, and not only that, are destroying democracy. But I think this resource, at least for the moment, is still available. The final slide, please. This is a sign from relational activism. To love is to act. It's important to think, to talk, but it's most important to act, to begin to create a parent advocacy program. I wish you luck in doing it. Thank you very much.
Thank you very much, David and Carman and Clive. We've got about 6 or 7 minutes before finishing at 6 o'clock. We have had a couple of questions. One of the questions we've had, which is aimed at Carman, but I think anybody can chip in, is can you talk about where you're involved in parental advocacy? How were the peer advocates recruited, and how do you go about getting parents with lived experience to be interested in the role when their previous experience with the local authority may be negative?
Well, I also work with besides the advocacy work and the research work, I'm also run this family advisory board. And so my local authorities is Camden in London. So the group is parents or carers with experience with the children's service. So we run for over about 12 years now. So all our members have experience, obviously, and like I said, and then we meet once a month. It's ongoing since 2014, and is a share and learn space that everyone share the experience and Camden. So they have officers there, then they learn from us, and we work together, the co-productions, co-create, and do a lot of activity to shape the local authority, their practice. So our advocacy is coming from the groups, and where we recruit is usually when family or parents they might have CPX child protection experience, and then they step down to child in need and the case closed. At that point, social worker might tell the parents that this group exists, if they would like to join, to see if they want to join this group to share the experience or meet other family, meet other people that have the similar experience. So the idea is we want people that after they've gone through the case, but not in the case, because that might cause a lot of extra stress or false hope for people. that if they join this group, they might get a positive outcome for them because the relationship with this group. So it's not like that. We want people, they've gone through their case, and after they think in and understand, or they want to do something, even though they were angry, it's still welcome. They could come and share their experience, because it's a learning place as well. So what is not good, then we could feedback to the council and to make change. So, and then we have opportunity for parents to be trained as parent advocate. If we accumulate the numbers, then we will start a cohort. So far we have the second cohort. We've done 2 lots of people to get trained. Yeah, so that's how we source our advocate.
Brilliant. Thank you. And you've also, within that answer, answered one of the other questions, which is, where do you do this? And you've said it's in Camden. Yeah. So you've yes. already answered one of the other questions. One question was about, which is for Clive and Carman, I think, is about, this all sounds very exciting, and I can imagine people on the call are interested to find out more. And it's whether you're able to say or whether we can share after the meeting the local authorities where you did the research in England and Wales. Obviously, David made reference to Suffolk being a really good model, but I know that in some cases you're not able to say where you've done the research, but if you are able, can we share that afterwards?
Yeah, I mean, we're doing a workshop, sort of a webinar next week with Nuffield. I put the link in the thing. Webinar print. I mean, I wouldn't tend to talk about the sites unless because this study hasn't actually been finished yet. I mean, we've done research in Camden that's been published. Camden were happy with that name to be, disclosed, but we wouldn't normally talk about the sites we're doing it in. I mean, there are at this talk. I'll put the thing in the chat that we're doing next week with NFJO. There's people from Redbridge, I think, and Telford. We are doing some work with Redbridge, not under this actual grant, but yeah. So I mean, if you get in touch with us, we can put you in touch with people. I'll put my email in the chat, and I'm sure Carmen would too. I don't know, Carmen, if you wanted to say anything else on that.
No. Yeah, I personally, so besides doing these works, I do training, I deliver training as well. So Telford and Redbridge is places I've been deliver training with them to set up their service in there. Yeah.
Thank you. With 1 minute to go, I don't feel any other questions are going to be done justice to. So if it's okay with the 3 of you, I think we'll draw it to a close. Thank you, all 3 of you, for your time and for the presentation. It's really interesting, and hopefully lots of people have got a lot out of it. So thanks very much.
Thanks so much. Take care. Bye-bye.
Bye. Bye.